Live from New York. It's Thursday afternoon. This is Benefits with Friends. I am your host, Lou Bernardi. Thank you for joining us today on, not surprisingly, another kind of gloomy afternoon in New York. I'm going to bring in our guest for today, Jacob Sheridan from TPA Stream. Jacob, how you doing?
Hello. Good afternoon.
How's everything? I don't know where you're calling from, so hopefully the weather's nice and sunny and bright.
We're in Cleveland. Very similar weather to you. Yeah, we have a
Okay.
bunch of rain and some gray skies, but we're excited for this year.
It makes it a little easier to be in the office when it's a day like this, right? We're not missing too much out of, golfing or whatever
That's right.
whatever you do outside, gardening.
That's right.
So I'm really excited about today's show. Just demystifying claims data, how forward-thinking employers are making informed decisions. I probably should say group health insurance benefit decisions. There's probably no aspect of healthcare and health insurance that has changed as dramatically as data has changed over the last few years. So, we met a few months ago. We've talked occasionally, and I thought, it's definitely time to get you on Benefits with Friends. So I'm so happy you agreed to jump on. So I'm gonna let you introduce yourself, tell everybody a little bit about yourself, maybe TPA Stream, and then we'll start talking about Beacon a little bit.
Yeah, sounds great. Well, thank you so much for having us. We're glad to be with you today and excited for this discussion. A little bit about TPA Stream. So we're an insurance technology software company based in Cleveland, Ohio. We've historically been very, very focused on working with third-party administrators, those that focus on pre-tax administration and COBRA administration across the United States, helping them win new business and streamline back office operations with our two core products. Those two products are claims harvesting, a way to capture claims data from insurance carriers on behalf of participants for any size group. So this works for small groups, medium-sized groups, large groups. If you have had challenges collecting claims data for various purposes, this product could be perfect for you. We've historically been focused on the TPA channel. However, we'll talk about our new Beacon product for brokers and how we're taking the same technology and providing it directly to brokers this year. We also offer a second product called employer invoicing, where we help our third-party administration customers take data from their various systems, bring it all into one place, help them send out invoices to their employer clients on a monthly basis, semi-monthly basis, quarterly basis. And then we've built processes to really automate the flow of collecting payments, integrating with accounting systems to help these administrators save a ton of time when it comes to managing how they make their money. So those are the two core products that we've had in the market for third-party administrators, and super excited to talk more about Beacon with you today and how we're taking this awesome claims harvesting technology and giving it to brokers and allowing them to win more business and have a different conversation with their employer clients.
So, for the audience out there, whether they're listening to it live today or, on a podcast site, why this is so relevant, just to put this in perspective. So if you're I call them a benefit decision maker. If you're someone in the C-suite, CEO, CFO, if you're an HR director or an HR manager or generalist, whatever you are, if you're involved with making group health insurance decisions for your company, one thing that you have to understand, and probably most do, but maybe it's not top of mind, is that the amount of information that you are provided with, in my opinion, is just enough to justify your next rate increase. That's what insurance carriers provide. They need to give you enough information to show you why, and that varies depending on the size of a company, right? So if you're in New York and you're less than 100 employees, you're community rated, you can argue that maybe it's not relevant because you can't change your premium. But if you're over 100 employer group in New York and pretty much any state now, because that's, 50 is really the cutoff for large employers in most states. But in New York here, where I'm domiciled, it's 100 plus. If you're 100 plus, you're probably at least partially experience rated, which means your claim spend is being taken into consideration to determine your future premium. So they look at the last, it's not even really the most current 12 months, right? Because it's a lag and everything, but they're using a 12-month period in the past to determine what your claim spend is, your premiums are going to be. And they're going to give you a lot of numbers. And actually, they're not going to give you a lot of numbers. They're going to give you the numbers that they feel relevant to justify their math to determine that renewal increase. And they're going to use things like retention and pooling charges and credibility and all these things that most people just kind of pretty much ignore. It's just simple. Here's your claims. Here's what your premium was. This is what your loss ratio was, and this is what we need in order to, to write your business or keep you on the books for the next year. And that's not enough. It's just not enough. There's so much more. And again, maybe not for this call, but to go into real depth. But there is so much more important information in that monthly claim spend, right? The breakdown of the medical and the prescription costs. And that's why I just want to start by saying, if you're out there and if you're listening to this conversation, you need to listen real carefully, because data is everything in healthcare. And that's what we're going to be talking about today. The importance of data, the amount of data you actually can get. Because as Jacob mentioned, you know, most employers don't think they have any access to data. They might not even think it's their right to have the data. And they might think that under HIPAA, they shouldn't have the data, and they're happy not having it, because having the data is going to open the door for a lot more in-depth conversation about benefits that really can lead the pathway for making much more informed healthcare, decisions. So, when I came across the Beacon product that we're going to talk about, it caught my eyes and ears, because we have a lot of clients who couldn't possibly have the insights that we've had the pleasure. I don't know if it hasn't always been pleasurable the last 30 years, going down the rabbit hole, and finding out just how bad it is, in the healthcare and the health insurance world. But that data that you can get from your insurance company is going to provide you, I call it actionable insights. So instead of just making random benefit decisions, you can make informed decisions. So I don't know if you want to elaborate a little bit more on what the Beacon specifically is within your products.
We'll talk about what Beacon does, why we built it, and how brokers can leverage it. And we'll also talk about the concept of loss ratio, which I think is something that all small businesses need to understand. And so, what we did a few years ago was we evaluated the ways that our customers were leveraging our technology. And we learned that there was a huge opportunity to do more with our claims data. We initially developed our claims harvesting product to automate the substantiation and reimbursement process for pre-tax accounts, primarily HRAs and FSAs, and also to automate the shoeboxing process for HSAs. We've learned that health insurance brokers have a huge opportunity to leverage this data as well to help their employer clients save money and make better decisions when it comes to setting up an employer-sponsored benefit package. And that can mean anything from a fully insured plan to a self-funded plan, even to an ICHRA that might make sense. But without having the actual claims data, it's really hard to figure out what to do. And there's been, talk over the past 10, 20 years around how self-funding is typically, makes more sense for larger companies that have, a couple hundred employees, 1,000 employees. But what we've learned over the years is that there are small businesses taking advantage of a self-funded plan, a level-funded plan, taking advantage of a MIWA, of a captive. There's so many different variations out there that larger businesses are able to take advantage of. And smaller businesses historically have been unable to evaluate these types of plans because claims data is typically needed to evaluate and underwrite small businesses for these alternative arrangements.
From my experience in talking with prospects, mostly because we kind of know where our clients sit, and whether this would be it can be a heavy lift to convince an employer, right? So we're a broker, right? And I've spent the last 5 years like just really completely changed paths of what we were doing in the past, really just focusing on the insurance because that's what we were trained to do. We assumed wrongly that the insurance carriers that we write group health insurance plans with get the best prices because of their leverage, because of their size. And that's simply not true. It's actually completely the opposite, to be honest with you. They use their leverage to create opportunities to profit off of every aspect of healthcare. Every claim that is paid, in my opinion, a portion of that ends up back in the hands of the insurance companies. I spoke with an underwriter this morning, 20 years with one of the largest, if not the largest, national carrier, and my jaw dropped on things that I could have only imagined that they were doing, that they're doing. I mean, listen, it's capitalism. It's not illegal. They can do it. The data is the only thing that's going to expose that, right? And when the consumer increases their awareness and becomes more informed, now you're going to be able to make the decision. Do you want to go back to that insurance carrier and do business the way you're doing it? And now you're going to have that aha moment of why we can't seem to get this under control. We've gone the spectrum, most employers since the early 90s, and that's when I started, right? 30 years ago. We went from a $2 copay, no 100% hospital. There wasn't even a prescription benefit back then. It was just part of the medical. You had a $2 copay for most things, to the $14,000 deductible HSA plan today. And that's a result of the annual exercise of just paying more, getting less, passing more cost on to employees in the form of contributions, but also passing that out-of-pocket exposure. And that singular focus on the insurance, because that's what you're given, is what caused that, because you did not have the data, the information or the technology. And frankly, even today, it. I mean, I can't call up an insurance carrier and say, hey, send me the report that Beacon can provide me. They're not giving it to us. It's not happening. It will hurt them in their pocket and, more importantly, on Wall Street, pretty quickly. And
Well, and let's talk about that for a second,
yeah,
right? I mean, there are carriers out there that do really profit on, from these small businesses, but there
mhm,
are some good ones out there. And one of the things that Beacon can also help to expose is when you have a good plan, right? When
sure,
a fully insured plan does make sense. And I think this just speaks to the value of data and being able to make more informed decisions.
you're right.
Because I think there is an opportunity for the majority of employers out there, but there are some that a fully insured, risk pool
Sure.
makes a ton of sense.
Oh,
If
absolutely. Oh, yeah.
so,
You're right. And I will dial that back a little bit. It doesn't mean necessarily that you might not be more appropriate to fully insure, because even though I'm a proponent of self-insurance, I know it is not always the solution that fits the group. You can,
right,
we have quite a bit of business that's with an appropriate carrier that, even though they are large group, they do not experience rate them. They bundle them with other similar size accounts, and that can be better. It still doesn't mean they're not profiting from the
sure,
claims. That's
sure.
kind of where I'm going. And I listen, I'm not blasting insurance carriers. What I'm about, and I think what your technology is, goes so far to help us um, address, is the unknown, right? Because the healthcare systems, the health insurance companies, regulations at the state level are only going to change for the betterment of the employer plan sponsor when it's exposed, and the consumer will make the decision, right? 30 years ago, we wrote nothing but indemnity plans. There wasn't managed care. There were no networks, but the consumer made a decision. We like managed care. We like a copay. We don't want the 250, 500, or $1,000 deductible. We like the lower premiums, because back in the day, there were true discounts. The consumer was king, and they put every indemnity company out of business. Chubb's no longer there. They migrated into like a Cigna. Guardian tried their hand in the benefit space. They might be in some states, but largely most of those carriers went by the wayside. And this is another opportunity for the consumer to say, we need to take the leverage back. We need to stop being a spectator. We want the data. We're going to partner with companies like yours, and we're going to get the data, and let's see where that takes us. And I guarantee you today, they're not listening to the show, but in the boardrooms, in those war rooms, where the top of the top at the healthcare and the health insurance world are, they have numbers. They know what consumer habits are changing already. They know what they're projecting, what's this going to look like in 10 years. And I can tell you firsthand, because I'm pretty aware. I try to keep a pulse on what's happening. This is why the health insurance carriers are so desperately and quickly trying to get into the healthcare world. They are buying practices because they know certain areas of profit are going to dry up, and they need to create more I use this English muffin analogy that I started with Eric Silverman, I think, in Austin, Texas. I said it's like an English muffin when you look at it. On the outside, it's smooth. I didn't know it was cornmeal. Eric said cornmeal on the outside. He knew a lot about English muffins, which scared me a little bit, but he did. And but when you cut it open, all of those nicks and crannies are where the profits are hidden. Our job is to try to fill those in, eliminate them as much as possible. They'll always be ahead of us. There's no question about that, right? Self-insurance is a great solution. It provides some capability, but I have a tremendous amount of opportunity in the fully insured world to give employers, as a broker, the data that a company like yours can help us provide. So let's talk about how do you, not from the real technical aspect, but how do you, with using Beacon, get that data?
Sure. Yeah. So what we've done is we've mirrored a process and approach that many of probably listening in are familiar with, which is very similar to if anyone on the call uses Venmo, right, to share money with family and friends. Venmo uses a technology called Plaid to link up to your bank account, and they make it really, really easy to make that connection. And what we've done is created something very, very similar for health insurance. And so we leverage individuals, their username and password, and any other information required to log into their online portal. When they sign up with our service, we make it very, very clear that we're going to be logging in on their behalf as their agent, collecting this claims data, and then sending it to a third party that we actually name as, and make it really, really clear where we're going to be sending the information. And so what we do is we have built an email approach where we can email employees. We give them information as to what the service is all about. We put the broker's logo on the emails. We make it really easy for employees to register, to sign up, to connect their health insurance account with Beacon. From there, we will log into that account on a periodic basis to see if there's any claims available. We'll pull those into our software platform. We make it really, really easy for all of our broker customers and our third-party administration customers through a standardization approach that we developed for all the carriers across the US. We have a very simplified and standardized data model that we then can expose to our broker customers. We've developed a number of reports to just make this information really easy to digest, understand, and then enable the broker to do their job, and to use this information to have a different conversation with their employer clients, and potentially carriers. We had a case study we talked about from last year where there was a 30 employee company that was given a very high renewal from their insurance company after all of their employees signed up with the service, and the broker looked at the data. They realized that their loss ratio was around 25%.
And they had, if I remember correctly, was it a 50% increase or 80 or something
It
insane?
was, it was, it was yeah, it was in the high 30s, I believe.
Okay.
And after a conversation with their current insurance carrier, they were able to bring that increase to zero. They weren't able to reduce the rate, but they were able to see significant savings by having the data and being able to then calculate the loss ratio. I don't know if you want to talk a little bit about loss ratio and
Yeah, let's talk
the
about that.
importance of it. Yeah, for really any business out there purchasing insurance.
So actually, just before we talk about loss ratio
Sure.
for a second, so I just want to make it again super clear that this is a technology, very user friendly. It's an email to an employee. The employee basically provides their login credentials, and then Beacon is going in, pulling that data, going in periodically to pull the new data. It can go back, from what I understand, as far back as you've been a member of that plan. So this is really useful, especially with a group that may be fully insured with the same carrier, because now you can get 2 years, 3 years, 4 years, 5 years. That could you imagine what an underwriter can do with that data? And really, so when you're looking at that data, it's not just is it just totals, or does it actually provide more detail on what the claim or the diagnosis was, like what was the procedure, what was the diagnosis, if it's a is it pharmacy information also, you know
Yeah. So
expand on that.
let's talk to that. So we're able to collect any information that's available in the online portal. We support medical, dental, vision carriers today, and obviously prescription through a medical login. And we get all of the information that you would see as a consumer. So that's typically all of the dollars and cents, provider information, procedure name, procedure codes. And we not only get that at a summary level for claims, but also on a line level basis.
And does this data go into some sort of dashboard, or is it just like Excel spreadsheet based? Is there a portal that the broker advisor or the employer can go into to
Yes,
review
it's
that data?
D all of the above, right? So we have a
Okay.
portal, we have spreadsheets, we also have reports in PDF form that can be used.
Okay. So wow, so if you can imagine the decisions you're making today about plan design, changing carriers, when managed the consumer, I try to think about the consumer's behavior. One of the things that the American healthcare consumer was very clear about for the past 25 years is network, network, network. The insurance carriers that grew the largest network the quickest were the ones that succeeded the best, right? Even till today, whether you have to make a call, do we go with a skinnier network at a cheaper price, or do we go with a larger network? Today, the larger networks are still getting the lion's share of the business, right? So because that's where the mindset is. If they have a bigger network, 60,000 doctors in my state, that's the one for me, even though you're not likely to use more than 3 or 4 or 5, maybe 10 doctors, right? But bigger's better. But bigger can also be more expensive. If you have this data and you're able to say, here's the doctors we use, imagine your ability to now say, hey, you know, maybe this other network, this other skinny network would be perfectly fine. What's the disruption? So, as a broker, that's one of the things, disruption reports. We do those all the time, right? We need to get here, give us if you're a large group, we can usually get a disruption report or a physician utilization report, and we can compare it against the competition. But small group can never do that. So that's useful in and of itself. And then obviously the claims. I didn't even know that you could pull dental and vision. That's news to me. That's pretty, I never thought about that. But so let's talk about loss ratio. So
Yeah.
loss ratio in its purest form for me as a benefit, benefit optimization officer, the boo, broker, consultant, whatever you want to call me. Loss ratio in its purest form is your total medical and pharmacy claims compared to the total premium that you paid over that same 12-month period, right? That's your loss ratio. So if you paid $1 million in premium and you had $800,000 in claims, then you had an 80% loss ratio. But of course, that doesn't tell the whole story, because now you have admin, retention, right? All of these pooling charges potentially, broker commission, fees, taxes, all of that stuff. So, it's the starting point of the conversation. So, if you want to add to that.
Yeah, no, and it's it's ultimately is driving the price of the premium for all these plans.
So with that
And
group that you were mentioning, I mean, it's hard to believe. So I'm assuming, right? Here's a group of 30 people. They get a 30% increase. They have no idea whether that's good or bad. They
right,
have they don't know. I mean, we had a claim on an account this past year. It was a $2 million claim. That can happen to a 30-person group. It can happen to a
right,
two-person group,
sure.
right? obviously they're protected from some, well, I guess obviously not a New York group that you're talking about, because they would have been community rated, which, to your argument before, that probably would have worked out really well for them, right? Because their claims don't matter.
Right. Correct.
But what you discovered, because you had a forward thinking advisor, you had an employer who has to make the decision, yeah, we want to do this, right? Because it's their call. A broker can't do this on their own. They need the support of an employer that says, for the sake of our plan and our employees, we do not want to continue to absorb 25, 30% increases every year. That puts us out of business. We can't compete. Our competitors could do a lot better. So they took the initiative, they rolled it out. I'm assuming close to 100% or 100% of the employees
Yep.
understood, because there's a conversation there to have. Why are we doing this? Right? You want to be very transparent to the employees. We need to do this. This is your health plan as much as is our health plan, and we can't absorb 30% again. So if you don't,
And you can't as well, right? I mean, typically
oh,
employees are paying a part of it as well, right?
no, there's no question. So they do it, and they find out that their claims are 20% of their premium. So let's just say, I don't know, let's just use $500,000 in premium, and their claims are $125,000, and the insurance carrier wants to raise it 30%. That's a $150,000 increase. They need $650,000 next year for a group that just had $125,000 in claims the prior year. That's fine, right? That math works out great. That's a extreme scenario, or is that something that you see time and time again?
We continue to be amazed at what the data shows us. And I think the point of that case study and this conversation is that you have to have the information
There's no question.
to have an understanding. And there are employer groups out there that have really unhealthy populations that need to stay on fully insured or should
Sure.
be looking at ICHRA plans, right?
Yeah.
And there's others that, have really healthy populations that should have gone to self-funding 10 years ago and
Right.
just didn't know. And, they might be working with a broker in their regional area that doesn't, that never has sold a self-funded plan or
Right.
never has been aware of a MIWA or different captives that are offered by different MGUs. And so, I think step one is just getting some information and understanding where you are and then being able to make decisions from there. And I'm a really huge proponent of a 3-year strategy.
No question.
You don't need to make changes immediately, right? And we're talking about some pretty extreme changes for small businesses that could be extremely valuable, but
Mhm.
going to cause change, and it might, there might have to be different providers utilized, different prescriptions taken, all sorts of other types of changes. And so I'm a huge proponent of get the data, year one. Year two, start to make some incremental changes. And year three, if there are some opportunities to make more changes, do it in year three after, you as the broker have had the time to understand the information, really understand the employer group, and create a plan design that fits what the employees need. And one of the other topics maybe we can talk about is the value of employee-centric plan designs, which I believe is where the industry is going. And with the current, economic climate and how hard it is to find great team members, benefits continue to be one of the ways that we create a really attractive workplace. And so, just another thought.
Yeah.
But I don't know if you have any other thoughts on loss ratio, but I just it's just so important that employers understand the concept
Well, we
because
have,
it drive the price.
and it's not always the groups that get the 20, 30% increase. We just picked up an account in Florida within the last 4 months that had zero increase for 3 years in a row.
Hmm.
But the conversation that we're having here on LinkedIn caught their attention, and they thought something was wrong. They knew something was wrong. They didn't feel right about it. They just said, "We know something's going on. We know that even at a 0% increase, which most employers would love to have, they're making a tremendous amount of money on us, and it's still a lot of money for our company and for our employees." So they allowed us to do some due diligence for them, right? And we competed with, I won't mention names, but two of the largest global insurance brokers in the world. And I was like, oh, this is gonna end well for us, right? Because most of the time, again, bigger must be better. In this case, it wasn't, and we kind of proved that. But our analysis was so different because of the data we were able to go back to them with, and then using that data after they appointed us a broker of record. We hadn't done anything yet, but our conversation was very different, and they knew it was impactful. And one of the first things that was very clear, and it's clear with 90% of our prospects, they're not looking for disruption in year one, but they want to start righting the ship, right? They want to get this thing back on track. It's one of the reasons why our agency is called Bright Path, right? It doesn't look so great today, perhaps for your company, but data is going to open up a whole new world of opportunity. And sometimes we do discover, you know, what you're doing now is actually maybe in your best interest. We can plan, we can tweak the plan design, but we're not going to change the funding mechanism necessarily from fully insured to self-insured or things like that. But what we discovered, similar situations, they had a 50% loss ratio.
Wow.
So zero increase, right? Now they made the numbers on the renewal, that financial exhibit, they made it look like, oh, this makes perfect sense. But they completely manipulated all of the numbers, the credibility, the retention, the trend. We took that renewal and compared it with another one from the exact same carrier that was renewing the exact same month with very similar headcount and said, all the numbers are completely different. All they did was plug this in to make the net increase work, right? And that's what employers need to understand, is that what you get in front of you at renewal time is the narrative that is going to justify what they're asking you for. They know your habit is going to be, let's negotiate this down to the best we can do. That's 99% of the time. It's still way too much. But you're going to be satisfied. Your finance team is probably going to be satisfied because that's what they budgeted for. And that's really where the data is so important. I want to talk to you about that a little bit real quick, is that this ability to collect the data, to harvest the data, is the paramount reason why the CFOs and the CEOs can get back in this conversation. Because I've had so many over the last 5 years tell me, I stepped away from this conversation because there was nothing for me to dig my teeth into. And I have to focus my time and attention on other areas of our business where we have negotiable operating expenses that we actually can negotiate. And they feel helpless to do that with their health plan, which is their second or third largest expense. This is the reason they should get back involved and collaborate with HR and their benefit advisor and go to work for their employees, because it is absolutely possible to reduce your cost of health insurance by 20 to 40% potentially. But let's just say 20%. What would an impact would that be of just reducing your cost by 20% and at the same time enhancing the benefits that you're offering to your employees, reducing their contributions? The domino effect is you can offer a plan that is night and day above your competition at a lower price. You'll be able to get their best talent from them. And where's that going to take your company? I mean, so this is like, this is something that, it's hard to get the audience sometimes because you're trying to tell them, hey, let's change the focus, take it off the insurance. Let's talk about the data. Let's talk about the healthcare, because that's really what the data is, right? What we're paying and where our employees are going for the healthcare they're consuming. I wanted to ask you a question, right? So one of the pushbacks that a lot of companies have when you talk about self-insurance, for example, is, well, no, we have high cost claimants, right? And what people need to understand is a high cost claimant isn't always what it appears to be, right? A high cost claimant might be your number one reason to explore self-funding. Might make it a little bit harder in year one, right? Because the claims associated with that high cost claimant, you have no ability to control when you're fully insured. You're not picking the network. You're not determining the discounts. You don't have any ability to bring in direct contracts. You don't have any control of your PBM contract, right? So when you do self-insure, and I'll just give you an example, and then I'd like to know your thoughts, is that we had one group was self-insured already, but with a national carrier, direct with a national carrier. And for years we talked to them, and again, 3 to 5 year plan. About the third year, they said, you know what? We want to try this. We want to go independent TPA. In the first year, moving to the independent TPA, which allowed us to bring in our own pharmacy benefit manager, that we didn't change the formulary one iota, with one exception. Same formulary, but different contract, different way the PBM got paid. That high cost claimant, which was primarily medication based, went from a $650,000 claim down to a $180,000 claim, right? And that's what self-insuring can do, because you're now able to pick your best in class partners. So have you had any experience with that, like taking the
Yeah.
data, have anybody come back to you and say, wow, using your data, we were able to do this?
Yeah. I think, yeah, you bring up a really good point with high cost claimants, right? As an employer, as a broker, high cost claimants typically, right, are you pause, right, and there's a bunch of concern around it, and a fully insured plan typically makes sense. But the control that you get with self funding is extreme and allows you. I mean, there's all sorts of different levers that you can pull to help manage costs for high cost claimants. I'm also a huge fan of ICRAs, right? Which,
Yeah.
I think it's the worst name in the world. I think that there's going to be some companies out there that introduce new marketing approaches to talk about them. But in certain markets and certain companies that have the ability to offer different types of plans, that's another approach that can be used as well. And, ultimately, I think that for every small business out there, really, if you have more than a few employees, there's an opportunity to leverage different types of plans, right? And to have a little bit of creativity. And I think it's, step one is finding a broker that's willing to evaluate different options. And then step two is gathering the data. But no, I completely agree. I think when you do have high cost claimants, it's almost a reason to learn more and to evaluate different options rather than to stay where you are. Because likely, if you do stay with a fully insured plan, and that high cost claimant is really driving a lot of claim volume, you're going to see some really, really high premium costs and a renewal increase that likely could be significantly lower with different alternative designs and funding options.
So you mentioned ICRA a couple of times. So for those people on the call that might not be familiar, like, let's just say
Sure.
an HR director doesn't know what an ICRA is. They haven't heard about an ICRA, right? Because a traditional insurance broker probably is not introducing you to an ICRA, right? So an ICRA is an individual choice health reimbursement arrangement, which means in layman terms is you are going to reimburse your employees for the cost of them going out into the individual marketplace to purchase a health insurance plan as an individual with certain criteria that must be met. Now they're going to give you that receipt monthly. We bought insurance, here it is, and now you're going to reimburse them X amount of money. Pick the dollar amount, X amount for a single, a couple, a parent, child. You can do it many different ways, right? But now, and why that could be a real viable solution for an employer is if you have an unhealthy population where you're in a marketplace where the claims of your members, that 30-person group that you mentioned, on the flip side, could have 180% loss ratio, and their premiums would be 250% higher. But they could go to the individual marketplace where typically, well, I know there's no health underwriting. Depending on the state. New York, even the individual marketplace is community rated, but in other states, it could be based on your age. I don't think it could be gender anywhere because of the Affordable Care Act, but you're buying it based on your age. That might be a more comprehensive solution, because if you're offering it as an employer, that same plan that maybe a gold plan on the marketplace could be 40% through your company because of the way that market operates and how they price plans. So an individual now this can be done with just a document, an HRA document, and just leave the employees up to their own demise to go out there and shop. Or there's companies out there that actually will assist in the purchasing. They will guide, almost like a navigator, help your employees make the plan decisions. They'll even give you a portal. They'll do some of the billing and exchanging. They'll collect the contribution through your payroll, just like you do on your medical plan. So it can be as much technology based and TPA kind of based as you want it to be, right? And maybe a 3-person group, 5-person group, 10-person group. This is the way to go.
There's a, we helped last year a one-person group. We connected them to one of our TPA clients who's
Yeah.
taking advantage of an ICHRA plan because he found that that approach was the best way to set up a plan. It provided the most coverage at the lowest rate.
There was so right now, important kind of disclosure is right now, this is treated by the IRS favorably, right? There was several years there where there was a gray area. Is
Right.
this legal? Can we do this? Especially, is this health insurance? If I'm an applicable large employer that has 50 or more full-time equivalent employees, I might not have been able to do it that long ago legally, right? So there's all of these different things. We have to trust that the TPAs that are doing this are up on the newest and must up to date IRS guidelines, because you don't want to be taking these deductions from your employees pre-tax and then find out this wasn't a legit deduction, and now you got an audit and your employees owe money, you owe taxes. So that's real important. But right now, my understanding is that this is favorable. We introduced it to a couple of clients this past year. New York doesn't have a lot of creative things. There's it's a marketplace that is really ripe for the picking for a lot of different types of solutions. It is very heavily GA centric, and GAs sell insurance products for overrides from insurance companies. So what the consumer and brokers end up showing is sometimes determined by the amount of information the general agent shares with the brokers, who might not actually be benefit experts. But so I just wanted to share that. I probably have to have a show one day or a guest on that can specifically talk about ICHRAs, because it is, I think, growing in popularity and definitely usefulness for sure, especially like you said, for those type of groups. Um, so so from your experience, right? I know a lot of advisors like myself who like to think of ourselves as forward-thinking benefit advisors. That's why I changed my title from broker, consultant, advisor to benefit optimization officer, because that's what we should be trying to do. Optimize our benefits for the spend that we can afford as an employer, so that people can get the best care. We're not doing what we do to save people money, but the way we do it does save them money. It just so happened. We're lucky from that standpoint. So what type of employer, maybe from a mindset standpoint, maybe from an industry standpoint, what are
Yeah.
you seeing as employers that are more likely to say, yeah,
Yeah.
we're going to do this, and not only that, but we need to do this.
Yeah. No, I mean, I think you have the early adopters, right? And typically technology companies, right? You have a lot of software companies out there, innovative companies that are in the technology field. They're typically quickly to implement a product like Beacon. They completely see the value. Their employees use Mint.com, Personal Capital, Credit Karma. It's just it's something that, and our approach is something that is welcomed with the early adopters and innovators. And so we see a lot of technology companies leverage our product and this approach. What's also been really, really interesting, though, is a lot of schools, municipalities,
Mm,
organizations that historically haven't shopped. They likely have the most opportunity to save money, more so than anyone else. And so it really runs the gamut. I really believe that any employer out there that doesn't have access to historical claims data and is working with a broker that's like truly using data that's specific to what has actually incurred over the past few years to help make informed decisions, can has a huge opportunity to optimize, improve, adjust their benefit plan, or just enable them to have a different conversation with their or their employee population. I think, at all companies across the US today, employees want information. They want to know what's going on. What benefits are we choosing? What benefits are we not choosing? Why did we change benefits? And by having the data, it enables employers to have a conversation that employees want to have. And if rates are going to go up 20%, we're finding that employees, are okay with that if they understand why.
Yeah.
But if they don't have an understanding, it leads to all sorts of nasty things like turnover and a reduction of, retention and all sorts of other issues.
In my upcoming book, which will be released sometime in the 23rd century, probably at the rate that I'm going, I talk about it all the time, but I'm making progress. I actually have a meeting tomorrow, try to first round of editing, but you just hit on something that's super important. When you ask people basic questions about, would you like to do this? How does this sound? Would you like to save money? Would you like to enhance benefits? Would you like to be able to provide your employees with a resource or a tool to help them access the highest quality healthcare? Everybody would say yes to every single question. Until you say, and again, I'm not trying to throw anybody under the bus, but I do believe this. Are you willing to spend an hour discussing it? Because it's possible. And that's where it breaks down sometimes, because it sounds like a lot of work, right? It sounds disruptive. This is different. We have been, and I use this word very deliberately, as an American healthcare consumer, brokers, benefit decision makers, insurance carrier reps have been groomed to believe we are getting great value from the healthcare systems and the insurance companies that we get our benefits with. They have our back. And we don't want to learn more because maybe we're just so far off course that the learning seems more painful than the benefits and the out-of-pocket costs and the premiums that we're feeling today. I mean, I truly believe that. And what we have to explain is, and I have this, I take it down from my show, but it hangs so it reminds me. If not today, when, right? And that's something that, for me personally, from a personal growth standpoint, I look at that. It's for me, but it's also for employers, because here's the ugly truth, and there's no disputing it. No, there's no one coming on a white shiny horse to rescue the American, employer's plan sponsor or the American healthcare consumer. There's no one coming to rush to save the patients, and no one's coming immediately and saying, let's drop the cost of all this. It's not going to happen. If you do not use every possible resource to increase your health insurance knowledge and healthcare knowledge, you're going to keep getting what you're getting for the past 25 years. Now, that doesn't mean you have to, you have three choices. One choice is keep going the way you're going now, pay more, get less. That is the guaranteed solution, right? Or spend 8 hours a day for the next 3 years trying to learn what Jacob has learned and what the PBM experts have learned and what the stop loss experts have learned and what the direct contract experts have learned and what Lou's learned as a benefit advisor about these systems. You can do that at 3. Good luck trying to spend 8, because that's what it took me. Or you can hire someone, partner with a company like TPA Stream, that can provide you the insights, that doesn't teach you the whole truth, but it gives you the power to be the consumer again. And my book will probably be titled Managed Care, Wall Street's Favorite Spectator Sport, because everybody loves the fact that the employer and their employees and the patients, because you're an employee that's purchasing or selecting a plan from your employer, but then when you take that ID card and you enter the healthcare system, you're a patient, right? So you wear a bunch of hats. The more informed you can be, the better the results. If you raise your expectations, if you set your expectations and say, just from this call, where's my data? That's all it takes. You're going to wake up a lot of your partners. You're going to wake up your benefit advisor and say, I heard about this thing, Beacon. Can you tell me about it? Why don't I have my data? Why 30% increase?
It's
That
so
employer
true.
hadn't asked the question, they would have never gotten that result that you helped them get.
Well, and Lou, I think, one thing that we haven't talked about today is just the questionnaire process that a lot of small businesses potentially have gone through, the medical questionnaire or the
Mhm.
individual health risk assessment, right?
Oh,
And while, I have, learned a lot about kind of approaches that small businesses have taken in the past to try to learn a little bit more from their employees and to try to get underwritten for different types of plans. Um, I think that a lot of small businesses either have tried that approach or haven't tried that approach and find that it does take a lot of time. And one of the other things that we've learned is that when employees self-report information, sometimes they provide too much information or the wrong information. And so it's really important. It's just been fun for me to learn how valuable getting
mm,
information from the sources and not necessarily through other methods or through questionnaires or through forms, or even meetings where you ask employees to share, issues they're having with different prescriptions. And so that, just wanted to share that as well, because I think it's really important for any small business out there that have looked at approaches in the past, have tried out filling out questionnaires, and how sometimes that approach doesn't actually provide what's needed to enable the employer to be a consumer, right, and to take control of their health plan.
well, that I'm great. You brought, we have a few more minutes left, so this is
Yeah.
great. This is actually great. I'm so glad you brought that up too, because, you know, some employers that we talk to, or just some prospects that are out there, they tried self insurance 5 years ago, 10 years ago, 15 years ago, and it blew up on
Right.
them. And
Right.
and what they need to understand is, although they changed their funding mechanism, they did not address the core problem, which is having the ability to control their healthcare spend, right? And having the data. They probably tried self insuring with the same insurance carriers that they were fully insured with. So they didn't address the rebates on prescription. They didn't address spread pricing. They didn't address the navigation, the very predatorial steerage of the healthcare system that wants to make sure every single test is done under the umbrella, the net of that healthcare system, and at the point where it makes the healthcare system the most money. That is what you're competing against today if you're out there in the healthcare world. So now we're talking again. So you tried that, and probably somewhere along the line, in order to get self insured, now maybe you had claims data, maybe you were a large employer, large enough where you had historical claims data, and the carrier had it, by the way. But maybe you're an employer that out there right now that is right around 100 employees, maybe less, maybe doesn't have any access to data. So the old way of doing stop loss, which is what you need to purchase because you're not big enough to just incur any claim amount, right? So you're going to purchase stop loss. That's the insurance that you're still going to have a base policy that covers you against any real excess claim of maybe 50, 70, $75,000 or more. So in the old days, you when you had not enough information, your employees were asked to fill out a health questionnaire. And 30 years ago, this was common on even a 5-person group. I mean, when I got in the business, every application included 10 to 20 questions. I don't know if you were involved in the insurance back then, but every policy, small group or no, and insurance carriers could just decline you. And then you had to go into this like pool, right? For bad risk pool. But anyway, most of the carriers that we're working with these days, there are no health questionnaires because they're using capture data and these huge databases that are released from all commercial insurance companies, pharmacy databases, you name it, credit card companies. They know about 4,000 different points potentially about every single person in this country, which is super scary. But if I gather just a basic census of names, dates of birth, addresses, of a population of from an employer, I can share it with certain companies. They're going to take that data and they're going to be able to zero in on the actual healthcare risk of that company and that population significantly more accurately than those health questionnaires. Like you said, those health questionnaires were voluntary answering, and there was
Right.
no guarantee people were truthful. There was no guarantee people weren't oversharing, like you said.
Right.
Yeah,
Right.
25 years
Yeah.
ago, I smoked a cigarette in the bathroom in high school. Smoker.
Right. Right.
It's
Exactly.
possible.
some of those tools out there are just incredible. The data that they're able to use to help with the underwriting process. And what we've learned is that, those approaches are awesome, especially when paired with our approach. And so,
Well, you're getting the data, right? You're getting the data. You're
well,
making that possible potentially, that initial underwriting. Hey,
exactly.
what do you have? Now,
Well,
your
and,
capture data is one thing, but you actually have the claims data.
well, and being able to understand what recently happened, right? A lot of the capture data is really, really helpful, and can really help to predict risk. However, you can't predict typically what's happened in the past 6 months or 12 months. And someone that might have improved significantly and their condition completely improved.
Sure.
And a lot of the data that might be out there on the internet associated with them would indicate that they're a really high risk. And so, just the importance of having the actual data, unbiased, what actually occurred, we've just learned is just beyond valuable in this space.
What one of the things that's happening at a huge clip nowadays is that the high cost claimants are more and more regularly just people on specialty medications, right? We're not talking about necessarily huge exposure to hospitalizations, inpatient, things like that. So there are many medications on the market today that are $20,000 or more per month. That's a $240,000 claimant, right? That's showing up. You're paying $240,000. The trend on that's going to be whatever it is. There's no way of you to circumvent that. So when we get a report from you and it's able to say, hey, here's the diagnosis potentially, right? So the data that you can collect from the insurance companies, I'm sure, is slightly different based on what that carrier has in that database, right? So there's
And
different
it's
fields.
available to consumers on the EOBs that are presented on the online portal.
Exactly. So some of them are going to be more robust than others, but
Correct.
they're all going to be significantly better than what you have today.
Right.
It's going to justify what you're doing. It's going to help you make decisions for that 3 or 5 year plan. It's going to help you identify needs of your employees that are lacking. You might look at that data and say, holy moly, only 10% of our employees had their routine physicals last year. That's 100% benefit, but they don't know it.
Flu shots, right?
Anything. The amount of things that this can help an employer do, and a benefit advisor like myself. Unfortunately, I can't just do it. I have to have a client and a prospect that says, that's what I've been waiting for. I didn't know it was possible. I'm not making another decision on my benefit plan without it. And I'm going to give a compelling reason for my employees, make them sure they understand this is a positive thing. This isn't Big Brother. We don't want to know about your healthcare claims. We want to be able to make decisions because this is our plan. We're spending
Right.
X amount of money on you guys. We want to make sure that that investment is being made in the best possible way.
Right.
Is there anything that I didn't cover today? I mean, this was I got to tell you, this was the fastest hour call I've had in a long time. This was great. I was a little bit more prepared. I told you I was going to have a couple questions this week, so I'm trying to up my game a little bit as the host. But if there's nothing else that you specifically want to say, but definitely do, how can people contact you? I'm sure LinkedIn, Jacob Sheridan
Yeah.
with a D, right?
Yes, you got it. Find me on LinkedIn, send me a note, send me an email, jacob@tpastream.com. I really enjoy working with TPAs, brokers, employers, and just adding value. And it's been really fun for me to work with an awesome team that's built some great software that's able to capture data to help businesses make better decisions.
Yeah, it's
Ultimately,
only going to get
through the
better.
broker and advisor. And so, so if you're a broker, advisor, GA out there, we want to partner with you. We want to work with you. The products we offer, aren't necessarily right for every group, right? But can really help. And so, we're just excited to be part of the health insurance world, to drive a little bit of value and to help small to medium-sized businesses and even large ones that don't have the data at their fingertips to be able to make better decisions and ultimately take better care of all their employees that are helping drive their business forward.
That's the reason why we do what we do. And thank you so much for doing what you do. Thanks to TPA Stream, and you're a great guest. I really appreciate it. I guess we'll we'll call it there. And thank you for joining us. If there's anybody out there, unfortunately, I can't see if anyone's out there. I know Chris Fisher and Amanda from your office were both on the call. So this was great. Looking forward to talking to you again, and hopefully let's get some employers interested and connected with you.
Sounds great. Thank you so much, Lou. Happy to be here. Hope
Thank
everyone
you.
has a great day.
Awesome. Thank you. Take
care.
care. Bye-bye.
Bye.